right, we are good to go. Let's get started. And again, thank you for the introduction. I really appreciate it. Excited about this. This is one of my favorite topics. It is a true game changer in dentistry, I sincerely appreciate the invitation and the opportunity to work with MicroDental. I can't say enough positive things about MicroDental and just how kind you've been to me and been a part of my practice for years and years and years. And again, it's an honor to be here. For years I have told patients about veneers and that telling versus showing, and it's been crazy how this one little technique has completely changed just my entire practice, to be real honest with you. And so I'm excited to share with you and all of the participants here just kind of how powerful this can be. And a little bit just about me, just so you kind of know who's up here talking to you. I am, again, Marvin Berlin. I'm in McKinney, Texas. We're just north of Dallas. I've been in dentistry, as crazy as this sounds, for 47 years. I actually started my career as a dental assistant back in the 70s. Always knew I wanted to be a dentist. And so I started as an assistant. I've been involved in a dental practice in some way, shape, or form for the last 47 years, either as an assistant or a student or as a dentist. And so I love this. I'm our biggest fan. I love dentistry. But one of the things I learned about as being an assistant was that dentistry was way more about people than it was about teeth. And with that, I started really focusing on this people thing and understanding our patients, if you will, and went to study business management, went to the business school at the University of Texas, got a degree in business, focused on that and management, and then went to dental school at Baylor here in Dallas, and always focusing on leadership, people, my staff, my team, and understanding that connection that we can develop with our patients was so important. I am clinical director of aesthetics and restorative dentistry here at Heartland. I created one of the largest or the largest porcelain veneer course online. It's porcelainveneercourse.com. We are worldwide, have over 2,000 members, and just teaching dentists how to do smile design, porcelain veneers, and just creating beautiful smiles all over the world. It's awesome. I am one case away from being accredited with the AACD, so I'm excited about that and just excited to be here. This is my family, and actually, there's a new addition. We just had I became a grandfather last Wednesday night, so this is Miss Chloe, and we're excited to welcome her to the world. And boy, this is life-changing. She's just a cutie, so excited about that. As I mentioned, I'm in McKinney, Texas. We're just north of Dallas. I'm probably about 30 minutes north of Dallas, right in the middle of the United States from left to right. And I've been here for pretty much my entire career. Our practice is a very unique practice. We do everything in-house. Every dental procedure, I work with four of the best dentists on the planet. And these are not just amazing dentists, but they're just great dads, great husbands, great sons, brothers. Are just good dudes, and they're really good guys to work with. And they allow me to do what I love best, which is creating beautiful smiles. And so honored. And I show our reviews because it's, that's something that you just can't buy. It's earned. And I'm just honored to have earned almost 2,500 five-star reviews in our practice. It's truly an honor. When we're in a live setting, I'll typically ask the audience right now, how many of you do root canals or do endo? And inevitably, probably about half or three-quarters of the audience to raise their hand. And I say that because if you sit down to do a root canal, let's say you're doing a molar root canal on number 31, and you could somehow magically see the final PA of your procedure before you could start. If you knew this is what your fill was going to look like, if you knew how you could obturate the tooth and it was going to look like this, how confident you would be in that whole procedure, knowing that that's going to be what your result looks like. And that's the power of the smile test drive, because we have the ability to create a smile and understand it for ourselves, create that confidence that we can deliver this smile, show that confidence to our patients that they know they can have that smile, and also the confidence of our team, of our lab, to know where we're heading, give us a better roadmap on where we want to go. And that is what started the smile test drive process. And a lot of times I don't know where we're going to go. There's so many times I'm going to do a patient come in this is a patient that wanted to do veneers. not a bad looking smile. And I told her, I said, let's just see where this goes. And I said, I'll create this as best I can. But sometimes you just don't know till you start building. But we use our smile design principles and we design a smile. And all of a sudden we create a really beautiful smile. When I handed her the mirror, she was like just almost in tears. She's like, oh, that's exactly what I wanted. Just a nice, clean, beautiful smile. For a lot of times, this is the first time patients have ever seen themselves with white teeth and they love it. It's crazy. And then sometimes I truly have no idea if this is going to work or not. And we so many patients wanting to do smile designs, and this guy's missing a lateral, it's missing number 10. And I'm thinking, wow, can I fix this with veneers? And I thought, let's just see. And so we'll start. And we built it and built it. And all of a sudden, you know, uh, built this case into, 6 veneers. And lo and behold, we proved to myself that this was doable. I'm going to show you this case live here in just a few minutes. But we see this a lot when patients come in with irregular edges and just things that we have a pretty good confidence that we could build. But patients will come in with the incisal edges all kind of chipped and cracked and rotated, and just in a perfect need for veneers, buccal corridor sunk in a little bit. And so when we design this with our smile test drive, we have the ability to give the patient the confidence to know that, hey, this is something that I can do. This looks great. And they can visualize this. And there's something about handing them a mirror versus handing them a phone to look at, or a picture on the wall or something like that. It's so powerful. We get a lot of peg laterals that come in and like, hey, I want to fix my peg lateral, my little baby teeth, they call them. And sometimes they just, can I just do two? And I was like, well, we can do that. And I said, we might as well see what it looks like to do four. And so when we do that, a lot of times, most of the time, they'll look at it and go, wow, yeah, that's where we need to go for sure. But it's that confidence that we're building in our patients to move forward with the process. And it's nothing like I've ever seen. And it's just one of the most powerful things. In addition, patients will come in. This was Cameron, and Cameron wanted to do veneers. And he told me right up front, say, Doc, I can only do 6. I don't want to do any in the back, not for now anyway. So let's just do 6. And so we did 6. And I said, let's just design it out, see what it looks like. And then we got home and talked, and I texted all my patients the night after, and I said, what do you think of that smile? And he's like, Doc, I think they're a little short. And I did too. I thought we could have extended the length a little bit, but it gave us the wherewithal to handle that now rather than with the final veneers, and realize that we'd made them too short. And so a lot of times, in fact, many times, we have the ability to really kind of create this smile that patients can visualize. When we create a design, a smile, there's really 3 parameters that we're going to look at. It's either going to be the length, the width, and the thickness of our teeth. And we can pretty easily tell the length and width. And I'll do this with what we call white line drawings. And I'll just draw teeth and just kind of, sometimes even in my head, I'll look at this and go, well, I know I can go on that number 9. I can make it a little longer. I can make it wider. So I know I can fix that. Can't. And there's no reason to even prep that tooth, because so many patients now are coming in and saying, hey, can we do this without prepping my teeth? It's like a social media thing. And so you've got to be able to tell them, yeah, yes, we can, or no, we can't, or whatever. And so a lot of times I can just draw little lines, and on our centrals, we draw one, we can copy, paste, flip it over. And I know pretty accurately, I know from a length and width of 2 of our parameters that we can do prepless veneers pretty simple here. And especially on our laterals, there's no issues there, because we can wrap around the whole tooth. The only area that I was really concerned was that facial of number 10. It was kind of rotated, and I thought that mesial aspect and the mesial line angle was a little bit forward. And so if we look at it in that area right on the facial of 10, I was like, well, and I told the patient, I said, this may be an area where we have to either prep that a little bit, or it might be that the portion is going to be a little bit too thick, or we might have to bulk that up a little bit. But I said, let me build it with composite. Let's see what it looks like. I'll make sure it's plenty thick. And you tell me if it's thick enough, and you let me know what we want to do. And so we built it up with composite. And sure enough, once we did it, and the patient got to look at it, she's like, oh my gosh, that's exactly what I want. And we didn't have to touch a thing. And so we were able to confirm that this was indeed a no prep case without touching anything, and could design that smile for it. And so that's the power of the smile test drive. It just gives us the confidence to know where we're heading and what we can and can't do. Because sometimes we'll do these and realize that the patients go, it feels a little thick, or it feels a little bulbous, if you will. But then they can decide, what, let's reduce a little bit and not make these as thick. But it's their decision, not mine. And I love when they make that decision. When I look back at the smiles that we've done over the last year, almost every one of these, we did a smile test drive. And I say that because we build this into our practice. This is a 1:00 procedure, and it's rinse and repeat. And we always do it at 1, because I want them to have a meal, go eat. Because when we do the smile test drive, They wear it for an afternoon. It's literally to show their friends, their family, take some pictures, some selfies, and then take it off before your next meal. We don't check occlusion. We don't check the bite. We don't, and they can't even close their teeth together. I don't even worry about occlusion. This is just for show, and it creates this urgency, if you will, because they get to wear it for an afternoon or an evening till to the evening, and then I tell them just go home, take your fingernail, pop them off, throw them away. But they get the chance to see what they can look like with veneers, and it's so powerful. When we look at marketing our practices these days, and if we had to boil it down to one thing simple with all the aspects, we all know that social media is the key, but the reality is if you want to make it as simple as possible, the key to marketing right now in 2026 is how do we get our smiles on this phone? How do we do that? And because we know that adults are looking at their phone 80 times a day, and it's just a proven fact. And of those 80 times a day, we know that 85% of those 80 times a day, they're looking at social media. So if we can have the ability to put our smiles on social media, which is going to be on the phone, which is going to be seen maybe by 80 times a day, that would be powerful. And so when I look at how my marketing cycle works, what I do is post on social media so that I can have a patient reach out to me. We do a virtual consult, and smilevirtual.com is a company that I use, a great company. And then it allows me to just introduce myself to the patient, share with some options, give them a price range. And then I end every virtual consult with an invitation to do a smile test drive. We do a smile test drive. And once we do the virtual consult to do the smile test drive, then the patient comes in to do a consult. We do the smile test drive, and the patients can see what their smiles look like, and then we move forward with veneers. The powerful thing is that almost 80% of our, 90% of our smile test drive patients move forward with porcelain veneers. It's unbelievable, unheard of. My case acceptance for normal crowns out of hygiene is probably 35%, something like that. But this process, doing the smile test drive, it's almost 90%. I think it's like 87% of our patients move forward with porcelain veneers. It's one of the coolest things I've ever seen. It's so, so powerful. Porcelain veneers, once we do the veneers, then we take our final photos, and we take amazing photos, really, really beautiful photos, get a testimonial, and then start that cycle over again, post on social. And that's the cycle. It just kind of keeps going and going. But our whole goal here is that we want to get this to where we can do a smile test drive. And if we can do a smile test drive, that can show them what their smile can look like. And there's never been a time it's so powerful when you can do that. And the mirror, to me, is one of the biggest aspects and the biggest ways that we can show them what they can look like. For years, I've told patients about veneers. I've shown them. And in fact, when I look back at how we've done our smile previews over the years and how, we used to just pull it up on the website and I would just look at a monitor and find a smile that kind of looks like that patient and say, Miss Jones, you're going to look something like that. Or we would take and I'd still do this today. I'll load them on my iPad and just have thousands of smiles and just show them, here's kind of what you can look like. And I'll find someone that kind of looks like them or their case looks like theirs and show them on their iPad. In my porcelain veneer course, I wrote a book, a porcelain veneer book, and they get this book. And this book is, again, just more pictures of potential patients that, from 2 veneers, 4 veneers, 6 veneers, 8, 10, 12, full mouth rehabs. And it just goes in order of various smiles that patients can look like. But inevitably, this isn't them. They're just looking at what other people look like. And again, it's powerful, but it's still not as powerful as looking in a mirror. And then we take pictures of before and afters, and they're all over the wall. And I'll tell you, from a marketing perspective, it's a lot easier to market the Berlin Smile than it is to market Marvin Berlin. It's hard to say good things about yourself. It feels kind of weird, but it's really like I can say, hey, the Berlin Smile, it's an amazing process and you're going to get a gorgeous smile, rather than say, hey, Marvin Berlin is going to give you some beautiful veneers. It's just a different process. So we own the Berlin Smile. It's what our team, it's what we're about. And it's truly one of the most powerful things that we've created in our practice. In fact, we just had about once a year, we'll have patients that come in and we do our new pictures on the wall. And this was this one right to my right. This is Miss Florida. She just won Miss Florida 2025. And so we're excited for her. She's competing in Miss USA. But inevitably, we're showing patients what they can look like in some way, shape, or form. And back in the day, I say back in the day, gosh, 10, 15 years ago, we would take we would take impressions, and who doesn't miss these days where we take impressions of teeth and then pour it up in stone, send it to the lab. Who misses this? I sure don't. Thank the Lord for digital scanners. Those impressions were no fun, but we would send it to the lab, and the lab would physically wax up our cases with wax, or we would now scan the case and we send it to the lab, and they would either use exocad or 3Shape or something to design it now digitally as we move into the digital realm. And we would either show our patients digitally what they can look like, or we maybe, if you have exocad, you can design it yourself. And there's another company called Smilify, great program. But again, it takes time. And again, you're kind of looking at a picture of what can possibly be, and it's still kind of digital looking. And in the simplest of terms, you can just do white line drawings. This is another aspect of something that where you just literally draw an outlines of teeth and just show patients, hey, here's an idea, here's kind of where we're heading. And then sometimes I'll just draw lines, just go, okay, you know what, I'm going to make them this long and this high, and this is where the gingivectomy is going to be, and just to give us an idea on where they go. Now, for the most part, if we're not doing a smile test drive, what we'll typically do is we'll send our case to the lab. The lab will do a digital design based on our instructions. And then if you have a 3D printer, they'll send the design back. We'll print it. We'll make like a Siltec putty matrix. And then from that, if you want to show the patient what they can look like, we'll do a smile preview, kind of a mock-up, if you will. Literally fill it with temporary material, set it in place, let it sit for about a minute and a half. We always time it with our Apple Watch, and we set it in place, and then literally we can pull this out and show them kind of what it can look like. And this is a powerful way to do this as well. It gets kind of messy. There's always some flash up around the gum line, but it can show them what it can look like. It's not as clean as I'd like it to be, but it's another option that we can use. And if we're about to do veneers, we can do this at the beginning of the appointment to show our patients where we're going. So it has its places, and especially if we're making temporary veneers, it has its place. Another way to do smiles is to do a line. You can do like in-face visualization. And this requires the photo using the Align iPad, and you have to use a photo uploader app. So it's a little. If you have your photography set up in practice, you now have to add a different way, and it's a little generic. I like it a lot. We use it, especially for our Invisalign cases, but it's still kind of generic, if you will. I know a lot. So another technique that docs are doing for the smile test drive is to do 3D printed, like lab assisted veneers, and where we can literally do a scan. And again, we can either print the model if you have a 3D printer, or have the lab print the 3D. The little test, the matrix here, the temporary matrix, and we can set that right on our patient's teeth and let them evaluate it. The difficulty with this, though, is one, getting it to stay on, and then two, if you look at it and they're, well, it's a little too short, it's pretty tricky to add composite to it. It's not impossible, but it's just kind of tricky to do, and so we got to be careful with that. But this is kind of, it still, though, takes a lot of time. You've got to scan the patient, you've got to either design it or send it to a lab to design it, send it back to you, print it. Then you've got to, once you print it or design it, you've got to then print the 3D model or the 3D temporaries and then try that in. So there's a lot of little clunky steps, and it's moving in the right direction, but it's still not as efficient as I'd want it to be. And then last but not least, and you're going to start seeing this more and more, is patients are coming in. We had a patient come in, just a couple of days ago, and she had her smile done via AI, and I think it was ChatGPT, and she prompted it out, and she was, okay, this is what I want to look like, and she was, this is the veneers that I want. And we've got to be very careful here. And I'm warning all of us here, is that this is something that can really haunt us if we want, because that's not veneers. We can't fix that right there. That's a different human being. That's a nose job. That's a facelift. That's a hair redone. That's a lip flip. And look at the frame of the teeth. Look at the size differential of just the teeth, of the smile frame, if you will. Let me draw the one on the left. And look how much larger it is. The AI took her mouth and made it, gosh, probably twice as open. And let me move those green lines. You can kind of see that took the upper lip and just totally just shrunk it in half. Well, again, that's not anything we can create with veneers. So we have to be careful what AI is creating and what we can deliver, because on that picture on the left, that's as far as she can open. I mean, that's it. And so we're not going to be able to deliver that one on the right, even though she came in thinking that that's the case. So we just need to be leery of AI. And these are subtle little things. A lot of times you don't even notice it. Also, looks like they put in lower veneers too. I mean, again, it's great to have that conversation, but just be leery that that's maybe something that we're not heading in the right direction or that you can't deliver. And in reality, this is where it gets even trickier, because this is actually her actual face. So if you, I mean, look at that picture, look at the AI version of what she looked like, and then look at what she really looks like. She's in temporary. Those are her temporaries right now. That's she's got 10 upper temps. And but look at her face. Look at the actual size of the face. And so just I'm showing you this to show you what AI is showing our patients what is possible, and in the reality of what we really can and can't do. Because it's I mean she's a beautiful lady. You can see that, but it's just she's not that person on the left that AI is saying she could be. So I'm just wanting you to be somewhat cautious of where we're heading with all this, and just making sure that when if you're having AI design some of your smiles, make sure you can actually deliver that, because it's I'm worried we're heading down a rabbit hole that we can't get out of. And so inevitably there's all these ways to show patients how you can look and how they can look, and I've tried every one of those. All those are mine. And but what I want to show you is what the way that's changed completely my career, my path, and I hope it can change yours. Now, so when we present treatment for a patient, let's say a patient comes in for veneers and comes into your practice, inevitably what we do is we schedule 2 hours for our appointment. We do have an hour for records, for FMX and scanning and photos and just the consultation, if you will. Then we present our treatment, and in the years past, we'd show them something and show a picture of teeth or whatever. And then, of course, we have to give them a dentist printout of what it's going to cost. And then they go home and they show their significant other. Hey, I saw Dr. Berlin today, and he said, boy, I can look amazing. And he showed me pictures of teeth, and I'm going to be beautiful. It's going to be amazing. And it's going to cost $25,000 or 20 or 30 or whatever your number is. But that's the protocol that we've all used. And, that patient has to relay the excitement that she had or he had when they were in the office to move forward. And a lot of times it's difficult to do. On the other hand, imagine if that same patient went home now looking like this, having a pearly white smile, grinning from ear to ear, tears in her eyes. You still got to do the dentistry printout, still got to pay for it. But now it's a whole different person. It's like, hey, look what Dr. Berlin said I can look like. Look at this. This is so cool. And this is that showing versus telling. This is the ability to just show our patients what they can look like instead of just telling them what they can look like. Because this is Lori. Lori had come in and she started out here, and when she came into the office, beautiful young lady. But when she left to go home, this is what she looked like. And again, these are not like AACD accredited, composite veneers that you spend 20 hours on. This is under an hour, and all of a sudden she's got a brand new smile to go home and show what she looks like. And that's how we do it. We literally do it for an afternoon. They come in at 1 o'clock, we do our consult, and then from 2 to 3, I do this procedure. They go home with their smile. They wear it for the afternoon. They show their friends, family, and before dinner, take a fingernail, pop it off, throw it away. That's how the process works. But this show beats tell. It's wow. This because when you hand them the mirror for the first time, it's crazy how bizarre this is, and it's one of the coolest reveals you're going to do, because there's no shots, there's no numbing. They're just all of a sudden they've got a beautiful new smile. Now there's some indications that are real critical about this before we show you the technique. Make sure you get a pre-op scan. You want to get a scan of where you're heading before, and a scan at the very end of the procedure. Make sure, because once you start doing these, you get to the point where you can actually design these quite well. And there's your design for your temporaries when you move forward with your veneers. Also, a lot of times we have a lot of patients coming in from out of state that I don't have time to have done a pre-op scan. And they're literally, I'm meeting them for the first time and doing their veneers that same day. And so this gives me the opportunity to create a very quick mock-up to show them what they can look like. I recommend and like starting with one side. Don't do your centrals and then your laterals and your cuspids. Do a side. And the reason I say that is because you want to show your patients the comparison of how much length you added. Okay. And it's typically about 1.5 millimeters, 2 millimeters. You'll get to where you kind of ballpark it. But overbuild, and then you'll be able to shrink them at the end if you need to. There's no etch, there's no no adhesive. This is composite on a dry tooth. That's it. There's nothing more than that. Also, during the process, make sure you take plenty of photos. This is amazing content that you can create for your social media. You can do it with one tooth, two teeth, a half tooth. The three pictures that I strongly recommend is the before, the half arch, and then the after of the smile test drive to show them where you have taken the smile. It's super powerful. As I mentioned, make sure you take that scan at the end because that can be very powerful for you to create a temporary matrix. You can also show your lab, hey, this is what we created, and the patient likes this, or like Cameron, like I showed you, he thought they were a little too short. Let's add some length, or let's round some corners, or lengthen some corners, or whatever the case may be. But you've got a digital scan of it, and so I don't forget that final scan. As I mentioned, you don't eat in it. This is not for eating. Patients are literally going to wear it for an afternoon, and then go home, and then before they have dinner, just take it, pop their fingernails, pop them off, throw it in the trash. Okay, that's literally how it works. One of the cool things, though, is you design this, which is different than designing something digitally, is you get to see the lips, you get to see the eyes, the midlines, the cants, what looks right. You can have them talk. You can literally kind of create their smile with them right in front of you and make some decisions about length and width and thickness that you can't make when you're doing a digital design and just looking at a stone model. It's so, so powerful. I put on here you save money. I don't do this to save money. I do this to do more veneers and show patients what they can look like. But inevitably, when you're doing less cases, less design work, and you're doing it yourself, it does save you a little money. But that's not the reason that I do it. I do it because patients are so appreciative of it. I mentioned about the photos. This is great content for your social media, guys. I cannot tell you how powerful this can be. And just, start with, one or two teeth and take a picture, and then do half and take a picture, and then do the full arch and take a picture. And just all of a sudden, this can be 6 different Instagram posts easily. Have it where you build this along the way. So many of my students ask about, hey, I know you did a lot of smiles. It's easy for you to post. No, the reason I post a lot is because I take a lot of pictures and a lot of pictures on each individual case. And so make sure you're taking plenty of photos. So when this patient saw her smile test drive, she was like, we're doing veneers. And so we matched it almost exactly. I mean, this is her you can see her veneers on her small test drive on the top right, and then those are her actual veneers. They look like mirror images. And so when we posted on social media, we also showed how we did the small test drive to create this for her, and that's something that we offer in our practice. By the way, I don't charge for it. I do this for free. Now you can charge for it if you feel like that's something you want to do. I don't want there to be any barrier not to do it. And because I know that 9 out of 10 are going to move forward with veneers, I'm investing an hour of my time to create these. It's about 5 minutes per tooth, and knowing that they're 9 out of 10 are going to move forward with the veneer. So it's a way for me to move forward and feel confident about it. I'm providing value. When I'm doing this at no charge, that's a huge value. The patients see that. They see how much work I've been put into it, and the sweating, and that I'm tinkering all around. And I want to make them absolutely stunning. I want them to be blown away. Remind your patients that it's reversible. They can take it off. This is not an exact science either. Everyone's different, and there's not a cookie cutter way to say this is exactly how you do it. And that's the beauty of it, because it's just what looks right, and what the feedback the patients will give you. And when you hand that patient the mirror for the first time, it's the coolest. I mean, it's almost better. This reveal is almost better than the reveal of the porcelain veneers, because they're not numb, they're not sedated, they're not worn out. They're literally just came in for a consultation, and now they've got a beautiful smile. I mean, it's really powerful. And this is that white tree analogy. This is something I've used for years. I love the white tree analogy, because the white tree analogy means that there's a picture we have of a white tree. In fact, I'll show you here. And this is reminiscent of a dental, say McKinney, Texas, or Dallas, Texas, or Texas in general. And these are all dental offices. I know in my office, in a 10-minute radius, there's 422 dental offices. Of those, I'm the only one that does smile test drives. That's it. And because of that, I'm the white tree. They're all are great practices, but I'm the only one who does smile test drives. So doing that, I know that because I get patients asking all the time, hey, I hear you do smile test drive. I want to see what I can look like. And so just know that that's our goal. And so when you hear me say the white tree, that's what I'm talking about. When we start designing these, and we're going to start here in just a second, the first question I always get is, well, how long do you make them? How long do you make your essentials? And you can get as nerdy on this as you want. And I'm the biggest nerd there is. You can start, and we know that the length to width ratio that we ideally like is typically about 75%. So if we know the width, we can divide by 0.75 and get the length. And so for this case, if it's 7.5 width, we know that we want to be 10. And you can do that and measure it out. And we know that if we draw a line from our essentials and our cuspids, we kind of want that line to be about the same. We want our laterals to be underneath that. Those are just some basic smile design principles that we kind of abide by. We want our incisal edge to follow that lower lip. Again, those are just a broad generalizations that we all kind of, when we start designing smiles. But inevitably, what I recommend is just extend them about 2 millimeters is typically the norm. That's what most of our adults have ground their teeth away. And then just start there. Overbuild them because it's a lot easier at the end to shorten things with the disc rather than add composite back with going through that whole process of adding composite. It's just not as easy. Leave them a little square at the beginning as well because you'll want to round them to fit. If you over round your corners at the beginning, it's difficult to unround them. It's difficult to make them more square, but we can make them more round. You can't make it more square. So that's what, leave them square at the very end, just round your corners as you see fit. But do the one, then do the two, then do the three. Again, do a side, fill out that buccal corridor. Make sure you fill those premolars out a lot. You want to make sure that you almost over exaggerate the importance of building that buccal corridor because that's going to be the difference in doing 6 veneers and 10 veneers. So make sure you show them the importance of that. And so I always do that. Finish the other, take that photo, do the other side, and take that photo there. And those are your three: your before, your halfway, and your after. When we delivered her veneers, I put them up side by side, and these were pretty close. These were actually kind of where we had anticipated. And you see, our length was pretty spot on. The corners were a little square, but that's okay. We designed that more with their temporaries. But that was Lori. In fact, let me introduce you to Lori. This is pretty cool. Hey, it's Dr. Marvin Berlin from McKinney-Dentist.com and home of the Berlin Smile. And I'm excited to introduce you to Lori. She is an amazing influencer, one of the leading top influencers in the DFW area when it comes to social media. And she's one of our very, very favorite patients. And I remember when she came in, I'll never forget her very, very first appointment. We always like to start with doing a smile test drive. And on our smile test drives, we literally build temporary veneers right on the spot. And I could just tell as we were starting to add 1, then 2, then 3, then 4, and this was going to look really cool. And I'll never forget handing her that mirror for the very first time and her reaction. It was just awesome.
That moment, I was just like, oh my gosh, I can't believe that this would be possible. And so the test drive is what sold me.
And you're going to hear that a lot. Anytime you do a post-op interview with your patient's testimonial, that's what it's not the office. It's not the pictures on the wall. It's not the website. It's not me. It's just all of a sudden they've got a new smile. And I ask you this, would that be worth an hour of your time? Because that's it. Now your first one's going to take quite a longer, and then your second one's going to be a little shorter, but you'll get to the point where it's about 5 minutes per tooth. I mentioned that length importance, and I want to show you why. This was a patient that came in and wanted to do veneers. So we did the smile test drive. We started here, and there's half. We did the left side, and there's the bottom half. But if you look at that top picture and the bottom picture, look how similar they look. And almost, in fact, when I handed her the mirror, she first said, "Oh wow, you didn't add any length." And I went, "Well, no. Let me show you this middle picture to show." Oh, we did. We added about 2 millimeters. It's funny how they all of a sudden forget how their teeth used to look. They love the whiteness, but they forget the length. So that's why we take that middle photo. And that's why it's important to do half and then half. Same situation with this case. We did half, and notice how the top and bottom look pretty similar, but that middle picture confirms how much we added. And just, again, we want to confirm that. Don't be over analytical on yourself. This was a patient that I had a patient that drove from Brownsville, Texas to McKinney. Guys, that's a 10-hour drive. She saw us on social media and she heard that we did this thing called the smile test drive. She wanted to see what she looked like with the veneers. And it had been one of those days, crazy days, bunch of hygiene checks. And at the end of the day, to be honest, I was probably on my B game. It wasn't my A game. I'm just being honest. And I wasn't where I should be. And I did her smile. I did the left side and it wasn't looking great. And then I took my picture, but then I did the other side. And then I screwed up. I took a disc and I flattened it out and I ruined it on the right side. And she saw my face and she said, "What happened?" I said, "Oh, I'm so sorry." I said, I shortened them too much on the right side, and I said, "Let me fix it real quick. It's not the look I wanted. I want this to be perfect for you." And I kind of caught myself, and she said, "Well, can I take a look?" I said, "Yeah, but I'm not done." So I handed her the mirror, and she just starts bawling. She's like, "Oh my gosh, this is what I've always dreamed of. I've never had white teeth. I've got white teeth. This is exactly what I want. Don't change a thing." I said, "Well, I'm gonna change them. They're not gonna look like that." She says, "No, this is what I want to do." She literally stayed. We did them the very next day. I fixed them, by the way. They didn't look like anything like that. But my point of this is it doesn't have to be perfect, okay? To them, it's just white teeth, and that's what they're looking for. So just understand that's where we want to go with this. And just, you're building trust, you're having this emotional buy-in. And again, I consider this marketing. I consider, my investment of my 1 hour time is the marketing budget of $0, but because it's so powerful. You'll get patients coming in with peg laterals, and remember with peg laterals, we want to increase the length both in the gingiva and in the incisal ledge. And as we talked about earlier, we know that from our central length, if we come about a half a millimeter down, that little blue line should be about where uh, the zenith should be on our laterals. And so if we bring that line down, we can actually just build composite right on top of the gingiva, and just to show patients how we're going to do a gingivectomy to raise that CEJ. And so you can see that there. In fact, let me move the lines again. And you can kind of see how we increase the length both in the south and the north to make sure that we can create the smile that she wanted. Had a patient come in, and he right off the bat, he said, "Doc, I want to do 4 veneers. I hate my front 4 teeth. There's chips and cracks. Let's do 4. And I want to square them up a little bit. I've always had square teeth, and I've just beat them up." And I said, "Okay, so let's do that." And we started looking at it, and I said, "Yeah, I don't know. He presented wanting 4. I said, "Man, do you mind? Let me just extend it. Let's see what it looks like." And so I did the 2 on either side. We ended up doing 8. And I remember him just looking at me in the face and said, "Doc, how in the world can I not do 8 veneers now?" And I said, "Well, I didn't mean to do that, but I just wanted to show you that we can come a lot better if we do that." And sure enough, when we did his veneers, we did upper 8. He let me around those corners, make them look a lot better. And so that's the whole it just sets them, and it lets them make the decisions that instead of us telling them what to do. And that's the power of all this. What you're going to see in this process is going to help your smile design skills. Your anterior composites are going to get way better. Your temporaries are going to get way better. You're going to get tons of referrals because no one else is doing this. Once the word gets out that this is what you do, it builds confidence in yourself and with your patients, with your team, with your lab. You're giving your lab a roadmap on where you want to go. It's super powerful. Great content for social media. No one is doing it. It doesn't really cost anything to do. Like there's no machine you have to go buy. You have probably the composite in your office. And so here's the technique that we're going to learn. First of all, it's flowable composite on a dry tooth. And now there's other ways you can do it. I know Dennis Wells did it where he packed some teeth on there. You can do it any way you want, but this works for me, and I'll show you why. We're going to take a clear matrix and we're going to reverse it, tuck it in the sulcus, and I'll show you. We're going to build from the gingiva up to the incisal. Okay. We're going to avoid any rotary instruments near the gingiva. I don't even touch the gums. The material we use is Herculite Ultraflow. It's a very inexpensive composite, but they're flowable. It handles so well. I only use shade XL1. I'm going to overbuild it, then I'm going to reshape it down with rotary instruments. Okay. And this is an absolute game changer, guys. And there's many applications. I'll show you a couple at the end here. But the composite, again, is Herculite Ultraflow. Now, I put on here B1. I rarely use B1. XL1 is about a BL2 to BL3 shade. It lets people see themselves with white teeth. And so that's pretty much all I use. We overbuild it, then we shape it down with the BFD, the big fat diamond, and that's the 856. And I use Strauss diamonds. And then once I do kind of a bulk reduction really fast, then I use my Super Snaps, these Shofu mini disc. I love these because they're just so easy to put on. They're very efficient. And now the green and the purple have 2 sides. So you can use the inside as well. But the reason I love these Shofu Super Snaps is the main reason is that they don't have any metal grommet. There's no hole in the middle, and that little metal ring doesn't scrape your composite resin, so that you don't have that metal grommet. So that's the whole reason I love these. They don't have that, and so they're just simple to use. And so that's literally all that we use is the 856 and these little discs, and it builds our every veneer that we do. My whole setup is a little tray we literally created at the Container Store. We've got our Herculite Ultraflow, our tips. You've got a big fat diamond. there in the top right, and we've got the super snap little mandrels, and then we have the polishers. Now we're going to use a polisher. You can use those the die comp polishers. The company called Strauss Diamond makes die comp polishers. They're just little rubber wheels. You can. There's also some from ASAP. There's uh, can't think of the brand. There's but they work as well. Clear, you need some clear matrix strips, just your regular clear matrix strips. I show curved ones here. You don't have to have curved ones. You can just cut up a little straight one about that long is all that you need. And then again, the super snaps, the mini discs from Shofu, and then you're good to go there. My whole armamentarium is this right here. I like to add a ruler just to measure things out and just to make sure that we confirm to the lab the length that we're going to use. But the secret sauce is this. We're going to use this clear matrix and we're going to do a reverse clear matrix into the sulcus. And I'm going to tuck this in and then we're going to use flowable and I'm going to build it up and I'm going to shape it down. So if I pop that off, it's going to look like this. Okay. This is what that veneer looks like. And again, that's just flowable composite shaped down. It's about 3/4 of a millimeter. That's about the average that I'll build those up. Okay. And now this area outside this white line is nothing that I would touch with a burr. Okay. So we want to and we know when we cure through a clear matrix, that's as smooth as a composite can get without damaging, I mean, without, we can't get it any smoother with the rotary instrument. And so we're not going to touch that anywhere near the gum tissue. So I'll show you how we do this. So imagine a patient comes in and asks, hey, can we do 4 prepless veneers? What would it look like? And you want to confirm that you can actually build it. So we're going to build composites onto these teeth to see if we can do prepless. So what we're going to do is we're going to take a clear matrix, again, about 2 inches long, and we're going to tuck it into the sulcus. And you're going to tuck it in like here. We're going to take a flowable composite and we're going to just flow it into that sulcus. Okay, let it flow, cure that. And you can also go ahead and finish your bead, just kind of finish the bead. Now, I was just going to say that you never any bleeding. And then I did this for you the other day and it bled on me a little bit. But that's already cured, so I'm not worried about it. But rarely does this happen. It just happened on this one. But fill that area in with flowable composite, and then just take your A56, smooth that out, and then take your Shofu mini disc, round your corners, and it's about 5 minutes per tooth. To do 4 on the anteriors, it takes about 15 or 20 minutes. And here's what it looked like. The beauty of this is that we knew going in that this was going to take us about 15 or 20 minutes. And now we know that we can do prepless veneers because I did this without touching any teeth. We added totally additive and she felt confident. I felt confident. There's no remove forward. But even if we had to prep some teeth, we could still show her what these veneers can look like. And that's one of the most powerful things we can do as well. And so let's look at it a little bit deeper. And I'm going to show a little video exactly how we do it. And so here's a case. And this guy had come in and I really didn't think we could do this prepless, to be real honest with you. When I looked at number 9, I thought, boy, that's a kind of in there. And so I looked at number 9. I said, well, I'm going to build number 8 and I'm going to make it a little longer than number 9 because I'm going to have to do that. And I said, let's see if I can build these out. So we did 8, then we did the right side and took a picture of that. And so we had the right side built and then we did the left side and let him take a look. He wore them for a few days and he fell in love with them. He's like, oh, this is exactly what I want. We ended up prepping a little bit off of number 9, maybe about a 0.5 millimeter, but that was the entire preparation on this whole case. But we confirmed that with this. And so that's the technique that we're going to learn. And so let's learn exactly how to do that. Here we go. I always like starting with this clear matrix and just wrapping it around the tooth. And then on one edge, just kind of tucking it under the sulcus. This creates just an incredible emergence that just takes all the guesswork out of that whole reshaping the gingival contours. It just really does make it simple. Flowable works great because it flows just under that sulcus and you can kind of do a perimeter bead around here and then just a real quick 1 second cure. You don't need a lot because you're going to be curing this a lot. And then you just want to fill that in really as rapidly as you can. Now the secret here is don't take that tip out. That way it won't cause bubbles. If you leave that tip embedded in the material and just kind of go back and forth, fill it up, fill it up, fill it up. I'm squeezing as I'm going. And then lengthen your tooth about 1 millimeter or 2, just wherever you see fit at this stage. It's nothing permanent yet. Once it's there, then you just kind of peel that around and you take a high-speed diamond with your big fat, the biggest diamond that you have. We call it the BFD, the big fat diamond. And you're just going to kind of wrap it around and just prepping it. Now, I prep clockwise here, not counterclockwise, because I don't want to be too aggressive. I'm more just shaping that bulkiness and just kind of following that gingival contour. Once I get the bulk of it done, I switch over to the Shofu mini discs, and I then get in front of the patient, as you just saw, just kind of flatten things out, looking at their eyes, and then just taking and kind of rounding my embrasures and rounding the interproximal emergence areas, and then just looking for any areas that's kind of bulky and smoothing it out. And remember, I want to try to create or recreate those three planes that the centrals have. You know, that gingival emergence, you know, the center plane, and then you've got the incisal 1/3 that almost comes back. This is what I'm looking for here. I'm just looking to make sure that I'm seeing three planes. It looks good. And again, the central is probably going to take you the longest because it's your first tooth. But if you get this first one right, then it's pretty easy to, or relatively easy to follow this in with your next teeth. This looks pretty good. There's a little spot right here on the distal that looks pretty sharp. I want to smooth that area up and that distal facial line angle, if you will. And then you just want to take that and round that off. That looks way better now. Again, I'm looking and just kind of following that contour. Once I like the basic contour, I'm going to take a less aggressive mini disc and just start rounding corners. This is, I don't want to overdo it here. If you use the black one, the coarse one, you can overdo it. Well, that central looks pretty good. And so let's take a picture of that. And sure enough, that's a good starting position. I like it a little bit longer. It's a little bit, and it's probably about a millimeter thick, maybe 0.8. But definitely not too thick. And then we do the same thing. You take that matrix band, that clear matrix, wrap it around, tuck it in the sulcus, hold it in with your left middle finger, and then just fill that area. I'm just holding it in place and do the same thing. I just wrap a bead 360 degrees around the periphery. The sulcus will hold that in place and just create a nice margin. If it flares out, you can take two like plastic instruments, just do a quick cure, and that'll help with your adjusting your interproximal contact areas. Do the same thing. Fill it in pretty rapidly. Lengthen it just a hair. I usually take it to the length of the central here, and then I bring it down with the discs. So hold it in with my fingers, cure it, peel that clear matrix off, and then do the same thing. Take my high-speed big fat diamond and just smooth. I'm prepping clockwise. I'm not really trying to prep counterclockwise. Counterclockwise is when you're aggressively prepping. Clockwise is when you're conservatively prepping. And take your black mini disc, the same thing. Now on your lateral, I like shortening them just a little bit. I get them about the same length, and then I'm going to go and just shorten it about a 0.5 millimeter. And again, that's something you and your patient can talk about. Usually you want a little bit of a lateral step so that that central dominance comes into play, and you've got a good looking central there. But this really does help. Less aggressive disc is great for these corners and just softening those corners until it feels right. Now this is a dude here, and so with a guy I typically leave them a little more square. And then once you get it where you like it, take your black mini disc and just again create those areas of emergence on your lateral, but get it to where it's smooth. And then again, I'm taking this disc over just really rapidly, just creating the best angles that I can, mimicking that central. This is starting to look real good. And then once your laterals are done, you're going to do the exact same thing on your cuspid. Wrap your clear matrix around it, fill the sulcus, fill the incisal edge, fill it in, and you're all good to go. Take a look at this. On the premolars, it's a little bit more difficult to get that clear matrix around there and kind of wrap it around. And so what I do is just by hand, I just do a bead on the buccal cusp and then wrap it around 360 degrees, just following that gingival margin, just like this. Once I've got that bead, I do a quick cure, and then it's just fill it in. I mean, this is a premolar, very little seen, but you want to have something on there just to show them how important that buccal corridor is. This is probably going to be about 1 millimeter thick, but I mean, instantly, this is basically done. You can go cure that and then just smooth up really quick. This shouldn't take you but a few minutes at most. Do the same thing on the first premolar, and then, honest to goodness, that's really how you do these premolars. Do not spend a lot of time on them. You just don't need it. Then once you get the shape like you want, we just want to go through and polish it. I love using these die cut polishers. These are great polishers in your kit. And I start with the pre-polish and just gently go over every surface and just get rid of irregularities and scratches and just kind of clean it up. And then we finish it with the high shine. And that high shine will put a really, really, really nice shine. Also, this is the same technique we use on our temporaries. And then once we're done, take a look at it. I mean, this proves that we can do no prep veneers here. We built that up. And then so we do a final scan. I like evaluating the scan. I'll actually send the patient this and let them see kind of here's where we started, here's where we ended, here's what's possible, and then let them take a look. And they can determine they're feeling it with their lips and seeing if it's too thick or if it just feels fine. 9 times out of 10, I will tell you they love it. And I rarely have someone say that it's too bulky or too big. So, hey, I wish you the best of luck. Let's go to the clinic and have fun. There you go. That's the technique. That's literally how this process works. And it's so straightforward. And the clear matrix just makes it so much easier for the emergence profile. Here's how that case turned out. Look how good that polishes. And again, it's about 5 minutes per tooth. You can see the finished result here and how good this looks. And I tell you, it's once you start doing them, it's powerful, powerful stuff. I had a case, and I showed you this case earlier, and I want to show you this one as well. We'll just show you 2 teeth of it. But this was one that I wasn't sure what we could even do. And I wanted to just say, let's just build some composite here and see what we can do. He's missing a lateral on 10. So we got to make 11 look like 10. We got to make a cuspid look like a lateral. We've got to make a premolar look like a cuspid. And we've got to close the diastema. And they're really dark. So let's see how's this going to work? And so when he came in, I said, let's just give it a whirl. And so what I did is do exactly what we just talked about. I take a clear matrix and on this situation, I'm going to split, kind of go in between 8 and 9. Now, when there's a diastema, you kind of have to hold it with your finger. Notice my left middle finger. I'm kind of holding that little band, the clear matrix right there. And I'm just splitting the difference between those 2 teeth and just to kind of even it out. And then when you start to fill it, it's as fast as you can go, guys. This is not something you need to be slow at. Just fill it up and you're just going to, you're making a central here. And so just make it where it looks like a central and just kind of widen it out. But that curvature kind of creates a nice, flow, if you will, for your line angles, your interproximal line angles. And then make sure with the composite, you want to have it where you've got the 3 planes, so it's going to be kind of a convex, not concave. And then you take your BFD, your big fat diamond, and just rapidly reshape that and just round it off. And then you stay away from the gingiva because there's no reason. That's already that's what's cured through the clear matrix. So the gingiva, like that, it's going to look like it's coming out of the gums. It's so accurate here. Then we switch to the black mini disc. This is when you just kind of do your bulk reduction, get your shape. And notice I'm standing right in front of the patient there, just to get that incisal edge straight across. When I do my corners, I use the green. That's the medium. Is not as aggressive, but it allows you not to over reduce those corners. Okay. And so I'm looking at that central going, that looks pretty good. Now let's make this cuspid look like a lateral. I thought, well, this was the big question mark of this case. Could I even do that? And so holding that in place, it gets a little tricky, but once you kind of get it in place, you can put some flowable in there. And then what I had the assistant do was tack that, and it'll hold it in place for us while I hold it with my finger. And I noticed there was a little bit that came out. You just take a little paintbrush and just wipe it off. It's okay. It happens. It's not the end of the world. So if you do, now go back and just fill it in. And again, I'm going to make this look as close as I can to a lateral, but it's a pretty wide space. So it might be similar in width to that central, but let's see what it looks like. And again, we don't know till we know. So let's give it a whirl. And notice we're just doing consecutive little 1-second cures. This is not like a long cure at all. I'm just one cure, one cure, one cure. And just again, because this is something to be as efficient as you can. I typically overbuild my lateral and then bring it back down with my disc. And because it's just so much easier to reduce the size of that incisal edge as opposed to adding composite over and over and over again. And so if you overbuild it, you can rapidly reshape it and kind of get it to where it looks. And I'm looking at this going, this is looking okay. I think that's going to look pretty much like a lateral. We'll see. And I thought, okay, this can work. And we were there was a little void here, so you can just go back and add at any time. It was kind of a little sunken in area, so just added some back. And then you take your The mini discs are great for your corners just to kind of bring those back in. You can go in from the lingual as well. Just, again, just flatten this out. And you see how these discs just kind of shape it right. And it's a little big lateral, but that's okay. I mean, we're taking a cuspid to make it look like a lateral. So I'll take that any day of the week. These lab wheels are great for your linguals really fast to just kind of rapidly get that shape on your lingual. And so I keep those steady. I don't really adjust the occlusion on these. I don't even have the patient bite down. I tell them they don't bite down for the afternoon. But looking at that, I was like, hey, that's not looking too bad. That looks like a lateral to me. We were thrilled. Went ahead and made the cuspid. There's our halfway point. And when we did the other half, I knew we were going to hit a home run because the right side was pretty much going to be just mimic the teeth. He was thrilled. I mean, absolutely thrilled. And there's no doubt we were doing his veneers. And so that was one of the most powerful cases. And because I didn't know, I told him, I said, there may be a chance when we get done with this that we might not do this. Again, we started with that one. We went to the 2 and 3. And then when we made that, we had the ability to see that this was something doable because we did it right and did it with composite built on his teeth. So he saw it happening real time and could feel it. Last case here, I'll just show you this. This is Carson, and Carson came in and was interested in veneers, and we were trying to look and see, did we have room to add, and did we have to do this in prepless? And so I'm looking at the arch form. I thought, we can build all those out. That shouldn't be that difference. I could look at the profile. We had room to build it out. And so as we started designing this, I wanted to make sure I filled out her buccal corridor. I always wanted to fill out that buccal corridor with the smile test drive. But again, just looking at her teeth, if I draw a line where I want those edges to be, and you can kind of visualize this with me, from a length and width point of view, we knew we can add some length here, and with the laterals, same way. This can work out just fine with just adding composite here. So this was kind of my mindset going in. Same thing with the cuspids. I knew I could just add some, make those a little bit more pointy, and bring those in, and show her what veneers can look like. By the way, if you want to make this permanent, like you want to make these temporaries, just put some spot etch on the teeth, maybe a little drop of bond, and then do this technique, and they'll stick on nice and firm. So if you do want to go through the step, hey, I want these to stay on, this is the process that you would do. But without that, if we're going to just do the smile test drive, again, do your halfway point, do a side, do the 501 side, take a picture. So you've got your smile test drive. Always take this picture. I get asked this a lot. How thick are these? Yeah, here's how thick they are. You can kind of see that there. And you would think that would be pretty bulky, but most patients feel that once they see this view right here and they get to see their new smile, they're pretty happy. And so every now and then someone will say they feel too bulky, but that's okay. That just means they can decide whether we prep or not. And so it's as simple as that. But that's the technique that we use. Now, that technique of wrapping the matrix in the sulcus also allows you to do some other really cool techniques. I had a patient come in, gosh, this was several years ago. We were going to do a class 5. They'd had class 5s done at another dentist, 19, 20, 21. 20 had come out. And instead of just, those are tricky to do, especially you can see the gums are a little inflamed around there, around number 20. What if we just did a bevel on number 20, and instead of just etching that small area, what if we etch the entire facial of the tooth? And I'm thinking, let's just do a whole composite veneer here and eliminate any kind of margin whatsoever. So we rinse and dry that, do the exact same technique, get a clear matrix, tuck it in between here, sink it in that sulcus. Okay, so it looks, let me show you from the profile view. And actually, I should have made that angle a little weaker, but still fill it with flowable composite, even into the interproximal area. And now what I do is do the whole thing with flowable. I use Omnichroma or one of the Easy Match or Simple Shades, one of those chameleon type of products where you just fill it all in, all the way up the facial aspect of the tooth. In this picture, I did some packable composite on top of the flowable, but I don't cure until everything's there. But pack it into place. If you want to, you can kind of bend those wings around a little bit so you can cure it in, but you don't have to cure it and then unpeel the matrix, and it's going to look something like this. I overbulked it, but it doesn't matter. It's going to take 5 seconds to bring it back down. That's what we did. We used the BFD, reshape that back down, get our mini disc to wrap around those corners. polish it with our diamond polishing paste. And then all of a sudden, instead of a class 5, we've got the whole facial surface. There's an infinite margin. There's no margin there. I mean, that whole facial surface is the margin, and that's not going anywhere. That thing will last for years and years and years. I've seen these things over 5 years, and they just look just like that. And so it's really, really powerful. Here's another case, and I'll just show you the before and after. Imagine treating that case and trying to figure out a way to make that, build composite there. What if you just took out that stain, took out those old fillings, put a clear matrix in there, filled it with flowable, cured it, and look how good that looks. This guy was thrilled. He couldn't believe that he always felt like his teeth were too curvy and too shaped, and he couldn't do it. And we just put some composite in there and all of a sudden made it where it was gone. He was like, this is the greatest thing ever. And all we did was that technique that I just showed you. So there's some powerful ways that technique will work. The one areas that this technique will not work, and the cases you want to avoid, is anytime you have a patient that wants smaller teeth. Okay, so this patient on the right here, she didn't like her big centrals. Well, I can't add composite to that to make those smaller. So that's going to be an impossibility. Same thing if we've got a buccal flare or class 2 situation. In fact, I had a patient come in, this was just Monday, and she was wanting veneers. Well, I can't do a smile test drive on a situation where you've got that buccal flare, and if they're flared out too much, we can't add composite to show them what decreased buccal flare is going to look like. So kind of makes sense, but just so you know before you promise over and over again. So when patients schedule with us for a smile test drive, my scheduler will ask them, hey, what are you thinking about? Are you wanting bigger teeth, smaller teeth? Almost everyone wants bigger teeth. And so this is a rarity, but just beware. Don't promise what you can't deliver here. So in a case like this, we send it to the lab. We ask the lab, hey, can you design this for us? Bring those teeth back in like we normally do. And so this is where we do a traditional scan. The lab designs this for us. Austin over at Westbrook designed this for me, brought it back in, looked great. And this is it. She was thrilled. And that's where we're going to start. So the question now comes, where do we start? And where do we go with this? And I get this question a lot. Start with your team. Find somebody Monday morning that is thinking about veneers in your practice and do the smile test drive on them. Find a family member, someone on your team's family member. Find somebody that can help you out, or that's interested in veneers that you're willing to try this on. I guarantee there's somebody on your team that's wanting veneers, and this is a chance to see, one, if they're a good candidate, and two, if you can practice on the process. Once you start doing it, guys, it's about 5 minutes per tooth, and you get to where you kind of like them. It's kind of fun to do them, and it's always the response is always powerful. It's one of the coolest things that I can imagine is this awesome. And so with that, I'm going to stop and answer any questions, and I'll, I know it was kind of rapid fire, but I wanted to get through that technique and show you how we do this and how we can really change some people's lives and move in a direction that's really powerful. This makes dentistry fun, and you kind of get your hands wet at the same time, which is kind of neat. And so, yeah, thank you guys for being here.